A woman with no ID was brought into the ER in the middle of the night. She had been having continued seizures for 45 minutes. She was unresponsive to any medicines given to her. This case left the team wondering what could be the possible cause. What exactly occurred that night? Why were the medicines not working? What could be the cause of this? Let's find out. Let's start from the beginning. The woman in the 30s with no ID was found convulsing in a train carriage by the train guard. He reported he found her on the floor, shaking and grunting. So he rushed to the phone to call an ambulance. The ambulance waited for her at the next station, which was 25 minutes away. The woman was convulsing on the way. In the ambulance, she was given diazepam. Diazepam belongs to a class called benzodiazepine, which decreases excess electrical activity in the brain by increasing GABA, an inhibitory neurotransmitter, and is used as an anti-anxiety, anti-seizure, as a sedative, and as a muscle relaxant medication. But it was of no use, as she continued to convulse for 40 minutes, all the way to the hospital, and now she is brought to the emergency room. In the ER, the attending doctor examines the patient, and this is what they notice. First, the patient was unresponsive with her eyes tightly shut, and secondly, her limbs were moving in an asynchronous, bizarre manner. She was moving violently and rocking from side to side. She was given diazepam again, but then she began to snore and her oxygen saturation started falling. She was intubated and transferred to an ICU. This was probably due to respiratory depression as a result of diazepam. So what is the probable differential diagnosis? The first thing that comes to the mind is status epilepticus. So what is status epilepticus? Status epilepticus is a seizure that lasts for more than 5 minutes or a series of seizures in a rapid succession without full neurological recovery in the interictal period, which increases the risk of long-term consequences such as neuronal injury and functional deficits, and if left untreated can also be life-threatening. So which conditions cause this status epilepticus? Firstly, it can be because of withdrawal from some anti-epileptic drugs. Secondly, it can also be because of some electrolyte imbalance such as hyponatremia or hypokalemia, which is decreased sodium or potassium in the blood. Thirdly, it can be because of some metabolic disturbances such as hypoglycemia, which is decreased glucose in the blood. It can also be because of alcohol withdrawal and recreational drug use. Lastly, it can be because of some CNS, that is central nervous system infection such as meningitis, cerebral malaria, neurocysticercosis, viral encephalitis, and it can also be due to some drug toxicities. Nevertheless, let's discuss the symptoms in detail. Number 1. A duration of the seizure was long, way too long for it to be called a normal seizure. But it can be explained due to some multiple seizures, some focal neurological deficit like stroke, some space-occupying tumor in the brain, or some CNS infection like meningitis. Number 2. Usually, diazepam acts on the moment. However, it did not in our patient. Number 3. The nature of her movements were very atypical. They were asynchronous and bizarre, which is not typical to a generalized tonic-clonic seizure. In a generalized tonic-clonic seizure, there is a tonic, there is a clonic, and there is a post-ictal phase. But this was not seen in our patient. But we cannot rule it out as some frontal lobe seizure do present in this asynchronous and bizarre manner. And lastly, Eyes during a generalized tonic-clonic seizure are open, but in our case, the eyes were tightly shut. Therefore, after discussing the clinical symptoms in detail, we understand that this is not a typical epileptic seizure. But then, what is it? This case puzzled the doctors on the duty. Nevertheless, doctors continued the treatment for status epilepticus because if it was indeed an atypical status epilepticus, then if left untreated, it could result in patient's death. In this case, an EEG, electroencephalogram, was needed immediately, but due to the incident occurring in the middle of the night, the EEG could not be done. Her blood electrolytes were normal. Her blood glucose was normal as well. She had no fever. She had no neck rigidity or photophobia, which is intolerance to light. Her blood profile was normal as well. After a few hours, the patient wakes up and starts shaking. The nurse notices this and pages the doctor. When the doctors arrived, she starts shaking more bizarrely again. She had to be given phenytoin, which didn't help either, and was finally sedated with propofol. But one key observation was made by the nurse. She noticed that the patient's symptoms had decreased when people are not in her proximity and they worsen when they are around. The nurse shares this information with the doctors, who were wondering to do a CT scan and a lumbar puncture in the morning, but now, after this, are convinced it's a pseudo-seizure or a non-epileptic seizure. Next morning, the patient wakes up and once again starts making the abnormal movements. The patient's TOC screen and blood parameters were normal. The EEG was also normal, so the doctors shift her out of the ICU. Later that day, her partner arrives and provides the doctors with further information. He states that last night she had run away from their house because they had an argument. She had a history of going to different hospitals and reporting complaints like abdominal pain and asthma-like symptoms, but she never followed up. And amidst these bizarre circumstances, the doctor witnessed something extraordinary. The patient's bizarre movements stopped as soon as her partner arrived. The partner gets her discharged before anything else can be done, and she never showed up for a follow-up ever again. Pseudo-seizures, also known as psychogenic non-epileptic seizure. This is usually seen in females and is associated with psychiatric disorders like obsessive-compulsive disorder and post-traumatic stress disorder. Usually, there is a history of physical or sexual maltreatment and substance use, and it usually occurs in presence of eyewitnesses. There is a generalized asynchronous motor activity as seen in this case. The eyes are usually closed and they resist being opened. Tongue biting and other type of injuries are rare. Awareness is usually unimpaired. Individual with psychogenic non-epileptic seizure can recall the event. Typically, this episode lasts for more than 5 minutes, as was in this case. And finally, a video EEG monitoring is required to confirm the diagnosis. So what just happened? It was a psychogenic non-epileptic seizure episode. The patient is certainly not making the symptoms up, but is rather in deep distress. It should be explained to the patient that this condition is caused by psychological stress. It is a maladaptive way of the body for coping with psychological and emotional stressors. In such circumstances, one should consult a psychologist and undergo counseling or psychotherapy to change their maladaptive responses. It is important to note that sometimes both status epilepticus and psychogenic non-epileptic seizures can coexist. Hence, the medications must be stopped only after confirming the diagnosis. We cannot, under any circumstances, undermine the importance of mental health. It is extremely crucial and must not be ignored. If you or anyone you know is in need of support, do ask them to reach out so all of us together can break the taboo and stigma surrounding mental health. Thank you for watching. Please like and subscribe if you enjoyed the video. Please mention your emergency room experiences and crazy medical stories in my comment section and my subreddit page r/Baby Aspirin. Also, I'm new to this platform, so any suggestions and requests are more than welcome. Thank you for watching and have a good day.